everybody, welcome to the Dr. Mom Show. Thank you once again for joining us. It's Dr. D, mom of 3. I'm so excited that you're with us today. Just a reminder, don't forget to subscribe to our channel. And you can do that on YouTube. And don't forget to check us out every Friday at 7 p.m. And I'm so excited. I have a couple grand things to tell you today. Check out our new edition of Thursday Tripsy Treat, and that will be on Thursday if you want an extra dose of love from these Tripsies. Also, I'll be announcing today's lucky winner of the random $150 Walmart gift card. The winner is Shelby C. Congratulations. Woo, Shelby, come on down to get your prize. Well, Shelby, please keep an eye out for an email from me. I will be contacting you to get you your gift card. Congratulations. Get on to walmart.com right now and start filling up your basket because you're going to have $150 to spend. Today I'll be talking to you about colorectal cancer. This is a special edition that we're doing because March is Colorectal Cancer Awareness Month. So this is just a tribute to any person or families that have anyone in their family with a history of colorectal cancer or a personal history of colon cancer. So let's start off with some statistics. So colorectal cancer is the second leading cancer in females. This is second to breast cancer. And for our male individuals, it's the third leading cancer following prostate and lung cancer. However, for both females and males, colon cancer is the second leading cause of death from a cancer. So this is pretty significant. So this is why I want to talk about this. If you're a healthy individual and you have no family history of colorectal cancer that you know of, and no other risk factors, usually your screening starts at 50 years of age. You want to discuss this with your regular doctor, so your primary care physician, or if you already have a specialist such as a GI doctor, who are also known as gastroenterologists, or if you have a general surgeon, some of them also perform these procedures. You want to discuss the different types of screenings that you can have. Some of these, probably the most common one that people know of is the dreaded colonoscopy that when I speak with my patients about, they're like, oh. And again, usually that's the first question I get when people come in for their physicals when they're 50 years of age. However, there are some other tests that you can do. So again, it is important to discuss this with your doctor. Another option could be something called a FIT test. This is newer. This is called the fecal immunochemistry stool test. This specifically has to do with your stool, something that you do at home. However, please keep in mind that if you choose to do this FIT test, if it comes back positive, your physician will recommend that you go ahead and do a colonoscopy. Just because with the colonoscopy, everything can get seen in your colon. With the colonoscopy, what happens is if you have any abnormalities that they see when they go up into the colon, or things called polyps, the repeat colonoscopy normally takes place every 10 years if it's normal. However, if the physician finds something abnormal or anything like these polyps, there's some factors that come into play. So one is the number of polyps, and two, when they send these polyps for biopsy, when that pathology comes back, depending on what it comes back as, you may require more frequent screening colonoscopies. So then those screenings could change from 10 years to every 2 to 5 years. And your physician would be the one who does it would be the individual who would tell you how often you need the repeat screenings. Now, speaking of colorectal cancer, it's the most appropriate time to take a look at how these Tripsies are doing at their potty training.
Elena, give Luke a high five again. Luke. Yay! Yay, Luke!
All right, I hope you enjoyed that. It's pretty funny getting all three of them on the potty, but they're making progress, so I'll keep you posted on how it's going. Now, we'll keep moving on with risk factors with colon cancer. So one of the biggest risk factors is if you have a first-degree relative with a history of colorectal cancer. A first-degree relative is somebody like your mom, your dad, or a sibling like a brother or sister. Usually if this is the case, your colonoscopies, instead of starting at 50, would start earlier. And it would either be at 40 years of age. However, it could even need to begin sooner. So for example, if you had a dad who was diagnosed with colon cancer at the age of 40, pretty much you would need your screening done 10 years prior to that. Therefore, your screening would start at 30 years of age. So again, it's just really important to always give your family history to your physician so these decisions can be made and these screening processes can start. Again, some other disorders that can contribute to earlier screenings include other family risk factors. Like if you have a family risk of multiple polyps, there's some disorders where people have hundreds of polyps in their colons, so that those patients would need to get screened sooner. And as I mentioned before, if when an initial screening is done and there's some abnormality that is located, you may need to get screened more often than the 10 years. Some other risk factors include a higher risk for patients who are African American, and male patients are at higher risk of colorectal cancer. Other risk factors include tobacco use in addition to regular alcohol use. So please be careful with things like that. And again, always inform your physician of how much tobacco, whether it's smoking or chewing, that you do, or alcohol that you drink. Some good news is there are some things you can do to protect yourself from colon cancer. These include dietary factors, so a high fiber diet, eating lots of fruits and veggies, drinking a lot of water, and decreasing your intake of processed meats or red meats. Another thing that helps is regular physical activity. Yup, I said it. Getting up and getting some exercise. Seems like today that helps everything. So with that being said, you should probably just exercise in any case because it helps everything. And then finally, there has been some research about the intake of calcium with it helping with decreasing colorectal cancer. That's still being figured out, but in any case, you should get enough dairy products in your diet, and again, that includes things like cheese, yogurt, and milk. So our fact today for No One Told Me That is that since spring is coming around, make sure you're wearing your sunscreen because the sun is going to be out even more. Just know that normally it's recommended that you wear a SPF of sunscreen of at least 30. So please remember that, because I know there's some sunscreens out there with a SPF of 15, but always remember that wear at least a SPF of 30. I hope you enjoyed this show and I hope you got some helpful information. Please take the time, it's still March and you can even do it throughout the year, to talk to your family about family history and to talk to your physician about your family history, and if you need or don't need a colonoscopy or a colorectal cancer screening at this time. If you have any comments, please do so. If you have any topics you would like me to cover, don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Thank you. Bye-bye.